I'm Phyllis Budesheim, and I'm a patient of Dr. Shriwise at Dickson-Diveley Orthopaedics. About 4 years ago, I began experiencing a lot of pain, and I found a wonderful doctor. He told me after several visits and after cortisone shots and a gel shot that there was nothing more he could do, that when I was ready, give him a call, I needed a total knee replacement. Never once was the word partial replacement mentioned. Then I remembered a lady in our book club that had a partial knee replacement. So I called her and asked her who her doctor was, and she said, oh, he's wonderful, Dr. Shriwise at Dickson-Diveley.
Phyllis had osteoarthritis of the medial compartment of her knee, which is the inner compartment of her knee, and I went through the options of treatment to include injection therapy, bracing, and of course the anti-inflammatories that she'd already tried. And in going through those options, I offered her the option of a partial knee as opposed to a total knee. And in fact, I thought the partial knee for her was a better option than a total knee. On Phyllis, I performed an Oxford mobile bearing partial knee replacement on the inner compartment of her knee. We divide the knee into three compartments, the medial, the lateral, and the anterior compartment. And so I simply replaced the medial compartment of her knee.
I only spent one night in the hospital, and when I went home, I did the exercises that the hospital gave me, and then for the next 2 weeks I had the home nurse came, and she added to those exercises. So I did all of my exercises twice a day, in the morning, again in the afternoon, and icing after each set of exercises.
When I saw her at 6 weeks, she was doing a little better than usual, especially for an 83-year-old lady, because she was already walking up to 3 miles a day. Her pain levels were 1 to 5 out of 10, so a 5 out of 10 pain level is significant, but she was only getting the 5 out of 10 pain when she was up to her 2.5 to 3 mile walk. And she wanted a rapid recovery, and so she pushed it a little bit, but that's okay because that was her preference in recovery.
The thing about Dr. Shriwise, and he said himself, I go to surgery with 2 toolkits, one a partial and one a total. So if you need either, I can do that. I say to anybody, I recommend, of course, Dr. Shriwise, but if something happens that you don't use Dr. Shriwise, make sure you have a doctor that does partial and does total and goes with both toolkits. I certainly can recommend without reservation Dr. Shriwise. The feeling that I have now being able to walk is wonderful.